Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. The incubation period of common STIs, the viruses, bacteria, and parasites that cause sexually transmitted infections, STIs, have different incubation periods, or timeframes between when they are passed on and when symptoms appear. Some incubation periods only last a few days, while others can last weeks or months. It is also possible to never have any symptoms at all. /r/n/r/n Knowing how long the incubation periods are for the various infections that cause STIs may help you better recognize the signs and symptoms if they occur, though this is not a sure way to determine if you are or are not infected. /r/n/r/nVerywellrnrn The time between exposure to a sexually transmitted infection, STI, and the onset of symptoms varies. It is important to remember that some people may experience asymptomatic, symptom-free, infection and still be able to infect others. /r/n/r/n The incubation period is the length of time between when you are infected with a contagious or infectious organism like a virus or bacteria and when symptoms first appear. The incubation period is not the same thing as the window period, which is the time between when you are infected and when a lab test is able to detect the infection. /r/n/r/n Chlamydia is an extremely common STI caused by the bacterium Chlamydiatrachomatis. It is readily passed through vaginal, anal, and oral sex but doesn't necessarily cause any symptoms. /r/n/r/n The incubation period of chlamydia is roughly 7 to 21 days from the time of exposure. /r/n/r/n Chlamydia is often referred to as a silent infection because most people with chlamydia have no symptoms or abnormal findings during a physical exam. /r/n/r/n Gonorrhea is a common STI caused by the bacterium Neisseria gonorrhea. The incubation period can vary by sex, in part because symptoms like painful urination and urinary discharge tend to be apparent sooner in males than in females. /r/n/r/n The incubation period of gonorrhea ranges from 1 to 14 days, with most men developing symptoms within 2 to 5 days. The incubation period in women can vary, but symptoms, if any, usually develop within 10 days of exposure. /r/n/r/n Syphilis is a common STI caused by the bacterium Treponema pallidum. It initially causes a painless sore, chancre, on the genitals, which may be missed if it is located inside the vagina or rectum. /r/n/r/n Syphilis infection occurs in stages. The initial stage, called the primary infection, is the period after exposure when symptoms may or may not occur. The incubation period for this stage is around 3 weeks but can span anywhere from 10 to 90 days. /r/n/r/n After the primary infection clears, the infection will go into a period of latency, dormancy. This secondary latent stage can last anywhere from 1 to 20 years. It is followed by the onset of new symptoms during the more serious tertiary stage of infection. /r/n/r/n Chancroid is an uncommon STI caused by the Haemophilus ducreyi bacterium. Chancroid is rare in the United States and is most often seen in developing countries in Asia, Africa, and the Caribbean. /r/n/r/n The incubation period of chancroid is between 4 and 10 days but may take up to 35 days. On occasion, chancroid can cause syphilis-like sores within 24 hours if genital tissues are damaged at the time of sexual intercourse. /r/n/r/n Trichomoniasis is an STI caused by a one-celled parasite known as Trichomonas vaginalis. Both males and females can get trichomoniasis, but the infection is often asymptomatic, in males especially. In females, trichomoniasis may cause vaginal itchiness and discharge with a fishy smell. /r/n/r/n The incubation period of trichomoniasis is between 5 and 28 days. /r/n/r/n scabies is caused by a parasitic mite called Sarcoptes scabiei. The female mite burrows under the skin and lays 2 or 3 eggs per day during her 1 to 2 month lifespan. When the larvae hatch, they cause an itchy rash. /r/n/r/n If you've never had scabies before, the incubation period may be anywhere from 2 to 6 months. If you were previously infected, symptoms may show up after 1 to 4 days. /r/n/r/n Genital warts are caused by a low-risk strain of the human papillomavirus, HPV. HPV generally has a very long incubation period, so it may be months or years before genital warts appear. /r/n/r/n Not all strains of HPV cause genital warts. In fact, most are relatively harmless. Some high-risk strains cause changes in cells that can lead to cervical cancer and other cancers of the genitals, anus, or mouth. /r/n/r/n If you are a female with genital warts, your healthcare provider may perform a pap test to see if there are any early signs of cancer. Less commonly, an anal pap test may be performed if you have anal warts. /r/n/r/n The HPV strains associated with genital warts generally do not cause cancer. /r/n/r/n Genital herpes is caused by the herpes simplex virus, HSV. Many people with HSV are asymptomatic and may not even realize that they've been infected. Even so, they can pass the infection on to others. /r/n/r/n The incubation period for the main cause of genital herpes simplex virus type 2, HSV2, is between 2 and 12 days. HSV1 can also cause genital herpes and is becoming more of a factor, especially in young women. /r/n/r/n HIV is the human immunodeficiency virus. HIV infection progresses in stages as the virus gradually depletes disease-fighting immune cells. Over time, this leaves the body vulnerable to opportunistic infections. /r/n/r/n The initial stage, called acute seroconversion, can cause flu-like symptoms or no symptoms at all. The incubation period for acute HIV is between 2 to 3 weeks, although symptoms can sometimes take up to 3 months to develop. /r/n/r/n After the acute symptoms resolve, the virus will go into a period of latency that can last 0 to 15 years or even more. Eventually, when enough immune cells have been destroyed, the infection can progress to the most advanced stage of infection, known as acquired immunodeficiency syndrome, AIDS. /r/n/r/n Without treatment, a person diagnosed with AIDS has a survival time of roughly 2 years. /r/n/r/n Hepatitis B is caused by the hepatitis B virus, HBV, and can be transmitted sexually as well as by sharing needles. Hepatitis B can cause chronic liver inflammation that can lead to liver damage. /r/n/r/n Hepatitis B is often asymptomatic in the early stages. If symptoms occur, the incubation period is roughly 90 days, with a range of between 60 and 150 days. /r/n/r/n Although many people are able to spontaneously clear the virus, the infection will persist in others, leading to a chronic infection. A small percentage will go on to develop liver cirrhosis, liver failure, or liver cancer years down the line. /r/n/r/n Molluscum contagiosum is a type of virus that can be sexually transmitted. Symptoms include an outbreak of smooth, pearly white bumps on the skin. /r/n/r/n Many, but not all, cases of molluscum in adults are caused by sexual contact. The virus can also be passed through intimate, non-sexual contact or through clothing, towels, bathing sponges, and pool equipment contaminated with the virus. /r/n/r/n Molluscum is also very common among children due to close contact with classmates and siblings. /r/n/r/n The incubation period of molluscum contagious is unclear but is thought to range anywhere from 7 days to 6 months. /r/n/r/n doctors diagnose different STIs in different ways. For example, urine tests can detect gonorrhea and chlamydia, whereas blood tests detect syphilis, herpes, and HIV. Testing for other infections requires genital swabs. /r/n/r/n A lack of symptoms is no guarantee that you don't have an STI. You may be infected and be able to transmit the disease to your sexual partners. That's why there is no substitute for regular screening. /r/n/r/n The timing of testing depends on which STI you may have been exposed to. With some STIs, a test can return an accurate diagnosis within a few weeks. Others may require you to wait for months before the test can accurately detect antibodies and other markers of infection. /r/n/r/n The time between the first infection and when a test can reliably detect that infection is known as the window period. /r/n/r/n While the incubation period and window period are often closely aligned, a few tests can diagnose an STI well before symptoms appear or when the infection is asymptomatic. /r/n/r/n Testing prematurely within the window period can increase the risk of a false negative result. This means that you have been infected even if the test says you haven't. /r/n/r/n Here is a general overview of window periods for some of the more common STIs. /r/n/r/n The incubation period of STIs depends on which one you were exposed to. The time from exposure to when symptoms appear can range from a few days to as long as 6 months. /r/n/r/n In addition, some STIs may not cause symptoms at all. That means you may be infected but be unaware of it. That's why regular STI testing is essential. /r/n/r/n/r/n/r/n Thank you. Form.email, for signing up. /r/n/r/n There was an error. Please try again. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.